Hi, this is Christina Coyle with Liberty University, Nursing 204. This is final didactic exam, take 2, and I will just go ahead and have them pan around and show you the area. This is the Blue Ridge Nursing Lab. We're going to start our physical today with head, neck, the face, the skin, and the first step with any assessment is just kind of looking at the person and looking for the things that we can see off the bat. So I'm looking at his color. I'm looking and I see that he has tattoos. He has a tattoo on his right inner forearm, on his left forearm. He has another one on his upper right arm. He's got a small bruise on the right inner aspect of his forearm, and he's got some primary macules here. He's got, let me see the other side. He's got a scar on the left interior aspect of the forearm. Let me see your face again. You have a small primary macule on the tip of your nose, a small primary macule on the right side of your forehead. Can you pull your pants up to your knees for me? He's got normal pattern for male for hair on his legs and his arms. He's got a few primary macules. As far as varicosities, he does have some on the left shin, and I don't see, and the right shin. The next step would be to go ahead and we're going to compare bilaterally, left to right, the temperature, and I will use the dorsal part of my hand, and we're going to go ahead and, if you will go ahead and set your, yeah, there you go. And he is warm, dry, his fingers are a little bit cooler, and that is bilaterally, his fingertips are a little bit cooler than his upper arms. Legs, they are warm. Feet and toes are a little bit cooler. And that is feet and toes bilaterally are a little bit cooler. The next thing that we're going to look at is his hydration. His skin on his hands is a little bit drier. It is a little bit cool out. We do have some snow going on, so that means that you need to increase your fluid intake. I do not see any flaking or seborrheic or anything on his skin anywhere else, just some dryness on his hands. We will check the turgor on the backs, dorsal parts of his hands, and that's fine, and the feet as well. And that's also fine. So the next thing that we want to do is check capillary refill, and we do that on the fingers as well as the toes. So I will go ahead and check. It is less than 3 on the right hand, less than 3 on the left hand, and toes are also less than 3. I will go ahead and do his O2 level at the same time as I check his nails, and we're going to check nails on fingers as well as toes. Again, looking to see that the nails are firmly attached to the nail bed. There is no sign of splinter hemorrhages or ridges in the nails. His O2 is at 97, and that's good. He's getting oxygen perfused through his limbs. Okay. His nails are fine. The nail beds are firmly attached to the nails. They're thin. They're within normal limits. Toenails, there are no signs of any type of fungal problems. They're not thickening. They're not yellow. They are clear. Nail beds and nails are firmly affixed without any kind of problem. So they're all within normal limits. The next thing we will look at will be the hair. When we look at the hair, we're looking for any type of spots, maybe any type of balding or anything abnormal. And if he has normal pattern hair, okay, his scalp is in good condition, his hair is clean, it is soft, it is thick, there's no signs of infestation, no signs of psoriasis or dandruff. His scalp is freely movable and firmly fixed. No problems. No signs of any lesions of any type. And so that looks good. The next thing we want to look at, as far as his face and head, is that his head is round. That we're always comparing one side to the other. We're looking for any kind of neurological signs, any drooping, any ptosis, anything like that. And I do not see that. Whatever's on the left is symmetrical with the right. The next thing that I will do is palpitate his paranasal sinuses. Let me know if there's any kind of pain. You have any pain? Okay. So patient states that there's no pain in paranasal sinuses. And the next thing we'll go ahead and do is I need to also check for the spooning, because that's important before we move on to anything else. So go ahead and put your thumbs together, and then each one individually. Okay, good. So there is no evidence of spooning in his fingers, and I just wanted to make sure that I covered that. The next thing we'll do is we'll go over the different nodes in his face and in his neck. So we'll look at the. Actually, before I do that, let's go ahead and do TMJ, because I want to keep an order here. So what I want you to do is go ahead and open and close your jaw. Okay. And then I want you to kind of push against my finger, and then I want you to move your jaw side to side. Okay. So I just want to make a note that there is no evidence of clicking, no popping. Did you have any pain in the?
No.
No. Do you have any pain in the mastoid bone?
No.
Okay, good. So there is no evidence of TMJ, and I did not hear or feel any clicking or anything like that. The next thing we will do is let's go ahead and have you smile. Smile with your teeth. Okay, Graham. Raise your eyebrows. Puff your cheeks. Purse your lips. Okay, good. Now go ahead and stick your tongue out at me. Okay. You can put your tongue in your cheek. Okay, good. All right. So there is good muscle strength in the jaw. I'm going to have you go ahead and turn against my hand here. Push against my hand, and go ahead and push back against my hand. Good. So he's got good jaw strength. And now I will do the sinuses and I'll palpitate his glands. So let's go ahead. This is the pre-auricle and the post-auricle. This is the occipital. And once again, when you feel for glands, you want to make sure you should not actually feel them. You shouldn't see them, and I don't see any evidence of them right now. Sometimes the body, if there's an infection, they will be swollen, or if the patient has had a prior infection, they may still be swollen. And I don't see any of that around the ears or the occipital. The sublingual, there are no problems with the nodes there. The submandible, no problems there. The submental, I do not feel any problems with nodes there. The anterior cervical, the posterior cervical, and the deep cervical chains are all within normal limits. The anterior or superior clavicular, there is no problem there. I do not feel any nodes there. The next thing we will do is I want to take a look at the neck and make sure that the trachea is midline, because I don't see any evidence of JVD and no jugular vein distension. I want to go ahead and this is your clavicular notch here, and so your trachea should be midline, and it is, and that's the way we want it to be. I will come around and palpitate your thyroid. Let me go ahead and move to the side here. This is an important thing to do. Make sure that you palpitate for the thyroid, because if there is a swollen thyroid, it does need to be addressed, and further tests need to be done. So what I want you to do is just bend your chin forward and tilt your head to the right. Okay. So what I will do is I'm going to go ahead and just place with my right hand and palpitate thyroid with my left, and go ahead and do the opposite. And that's good. I find no inflammation of that thyroid gland. And I will come around here, and I'm going to go ahead and listen to the carotids. I will compare first one side to the other. Lift your head up. Okay. Go ahead and hold your breath for a moment. Okay, let it out. And we will also auscultate the thyroid. Go ahead and there we go. Take a deep breath. Okay, I do not hear any signs of any types of bruits. So his blood flow is fine. The next thing we will do is we will go ahead and move to the eyes, to the exam with the eyes. And what I want you to do is I want you to go ahead and look at me. And normally when we look at some of these eyes, we're going to check for clarity. We're going to look for any kind of discharge. We're going to compare one side to the other. We're going to look at the eyebrows. We're going to see if the hair is equally dispersed between the eyebrows and the eyelashes. If it's thinning, we need to note that. If there's any drooping of the eyelids, we need to note that as well. There is no discharge. Let me go ahead and palpitate the nasal lacrimal. Okay, there is no discharge from the nasal lacrimal. And before I get into the actual eye exam part, I just want to explain a little bit about the Snelling and the Rosenbaum test. The Snelling test is a vision test that judges distance, and normally the person stands about 20 feet away from the eye chart. The eye chart consists of letters that go from larger to smaller, and the person covers one eye, reads as far down as they can on the eye chart, and then does the same thing bilaterally with the other eye. Then they read with both eyes uncovered, and depending upon what line they can read to, that number that they stop at is that line that they stop at is what their acuity level is. The normal would be a 20/20. The next test would be Rosenbaum, and normally the person is given a sheet of paper, and that sheet of paper may have some writing on it, and they hold that up and they read from the largest lettering to the smallest lettering. And what that does is it's going to measure what they can see at a near distance. And then depending upon the line that they stop at will be their near vision. And a normal for that would be a 14 out of 14. The next thing that I will do is normally the person, you would just have them sit in front of you, maybe at a distance of a few feet, and you just want to look at the clarity of the lens itself, and his lens is clear. The next thing that we're going to do is I want to test for accommodation, and we're going to look at his distance and then his near accommodation to something that is close up to him. So I have a little scribble on my paper here, so if you can, go ahead and take a look at that there. And then what I want you to do is do not move your head, just move your eyes and focus on something close. Okay, so there was a constriction of the pupils, which told me his eyes did accommodate for that change in distance. The next thing I will go ahead and do is I want to check to see his reaction to light. And the first thing I will do is I will go ahead and check the eye itself, and there is a constriction of the pupil. Next thing we will do is check consensual constriction. So when I shine the light in one eye, I'm going to be looking at the opposite eye to make sure that that pupil also constricts. So let me go ahead and do that. Okay. Okay, and there is consensual constriction of the eyes. My next thing that I would like to do is the 6 points of gaze, and so this is going to check his peripheral vision. And actually, what I want you to do is go ahead and hold the card up to one eye, and we're going to do little bunny rabbits. So I want you to tell me when you see it, okay? So let me know when you see the movement.
Yeah. I can see it. I can see it.
Okay, switch eyes.
Can see it. Can see it. I can see it.
Okay, very good. Okay. The next thing we're going to do is go ahead and take a look at the eyes and look for that red reflex. We do have the lights dimmed right now so that I can see. I'm going to go ahead and shine this into your eyes. And red reflex is present in the right eye and as well as in the left eye. Very good. Now I'm going to get a little bit closer and I'm going to go ahead and look into your eye. And I just want you to stay still. I'm going to come up real close to you. Just look ahead. Okay. All right, so the pupil is good. I see no signs of any kind of edema. I see clear and present veins, blood supply, disc, divide disc, yellow with pink. All right, let's look at this one here. Clear, blood flow, optic disc is clear, present, and with a yellow, pink, and veins are present. Good. Okay. So we've just looked at the eyes. The next thing we're going to do is we're going to look at the nose. We're going to look at the ears and then the nose. So the ears, with everything, we're just going to kind of look at what we can see first. The ears are, the pin is even with the eyebrow on both sides. There is no reddening or drainage from either ear. The exterior meatus appears normal on both sides. The ear is an appropriate size. Next thing we're going to do is I'm going to look in and I'm going to look at the tympanic membrane. Okay, there is a little bit of wax in this left ear. I see a clear tympanic membrane that is slightly gray. It has a white reflex. There is no sign of scar tissue on this ear. The other ear has no wax. It has a flat gray tympanic membrane, some shadow of Achilles, white reflex, and it looks good. The next thing that we would look at is, while I have my light out, is we're going to look at the nose. And once again, we're looking to see that it's lined up midline. And we will also check for a deviated septum. So let me go ahead and look into your nose. The septum is midline. There is no, let me get you tilt up. There is no sign of any kind of discharge. The turbinates are where I can see them. There is no reddening, no swelling. And what we need to do is we need to check the breathing. So we're going to go ahead and have him check the breathing. And I want to have you go ahead and occlude one nare, and go ahead and breathe out for me. And we're checking for the movement of the tissue to tell me that there is the breathing is okay through there. And go ahead and include the other nostril. Okay. And before we check the cranial nerve for smell, we're going to go ahead and we'll do the Weber and then the Rhine test. Go ahead and let me know if you hear that.
Mm-hmm.
You feel it too?
Yep.
Okay. Okay, that would be the Weber. This checks conduction of the hearing. Okay, let me know when that sound stops. Still hear it?
Let's stop.
You hear it now?
Yeah. Yeah. It's not.
Okay. So the conduction is longer for bone than it is for air on that side. You hear it?
Mm-hmm.
Let me know when it stops. It stops.
Yeah.
You hear it now?
Just a little bit.
Okay. So the bone conduction on the other side is longer. The next thing that we will go ahead and do is the whisper test. And I'm going to go ahead and walk around, and I'm going to whisper something in your ear, and then I want you to go ahead and repeat it to me. Sorry.
start.
Okay, good. That would be the whisper test. The next thing we will go ahead and do is check his sense of smell. So I will have you occlude one nostril, and I want you to tell me if you can smell this and what it is.
Hazelnut.
Okay. Hazelnut coffee is the first one. Okay, include the opposite nostril.
I got none.
Okay, good. Okay, so he has a good sense of smell. The next thing that we will go ahead and do is take a look at his mouth. Normally when we look, once again we're observing on the outside, so I'm looking for any kind of dry skin, cracking of the lips, cracking of the fissures in the corners of the mouth, and I see none of that. Let me go ahead and get you to open up your mouth. And right now we're looking for the ducts in the sides of the mouth, and they are there, they are present. I'm looking for the frenulum is present, it is intact. The teeth, he has some fillings, but the teeth are intact. The gums look like they are in good condition. There's no sign of bleeding gums or enlarged gums. They're clean. The tongue, go ahead and stick your tongue out for me. Okay, the tongue is not swollen, it is not cracked. There are papillae present. Let me have you go ahead and stick your tongue out. Say ah.
Ah.
Okay. Okay. And his gag reflex is present. Go ahead and just stick your tongue out. And move side to side. Okay, good. Okay, so he has the ability to not only gag but to swallow as well. So that means as far as chewing and swallowing food, he shouldn't have any problems. And he can verbalize, he can speak, so those problems would not be present for him. The next thing we will go ahead and do is move to the lung part of the test. And what I'm going to have you do is go ahead and take your shirt off. Okay. As with everything, we're going to go ahead and inspect first. So right now I'm looking for any kind of accessory muscle use, any kind of heaves, lifts, thrusts, and I'm not seeing that. I see normal pattern of breathing. He is not in any type of respiratory distress. The next thing I will do is I'm going to go around to the back of him, and I'm going to check his breathing. I'm going to walk through. Okay, so the first thing that I want to do is I'm going to go ahead and check his breathing. So my hands are cold, and I apologize. So go ahead and inhale and exhale. And he has normal excursion. I also need to palpitate for any type of crepitus or any kind of pain or bulges, and I don't see that. Okay. So there is no pain, there is no bulges, there's no sign of crepitus. What I'm going to have him do is I'm going to check his excursion, and what I'd like you to do is, if you can, cross your hands and just lean over the, yeah, there you go. What I'm going to have you do is I'm going to have you breathe in and then hold it for me, and I'm going to go ahead and measure the distance of your lungs, okay? You ready? Okay, go ahead and breathe in and hold it. listening for the change. Okay. All right, now let it go. All right, next time what I want you to do is take a breath, let it out, and then hold it, okay? Take a breath, let it out, and hold it. Okay. All right, you can breathe normal. Okay, so we are at 4.5 centimeters, and normal is 3 to 5, so that's appropriate as far as excursion. The next thing that I will do is I'm just going to go ahead and check for any kind of fluid. And you can just breathe normal. You know, I may have you sit up straight. Go ahead and sit up straight for me. I'm listening for any kind of change in the sound that may indicate there may be some fluid. And I hear timpani, so I haven't heard any change, no dullness in sound. The next thing that I'm going to do is I'm going to go ahead and auscultate and listen to your breath sounds. So just, if you would, just breathe normal for me, okay? And I'm going to compare one side to the other. I'm going to have you lift your hands up and put them over your head, and I'm going to come around and I'm going to listen bilaterally to your sides. Breath sounds are normal. They're clear bilaterally in all lobes. I hear no adventitious sounds. So the next part of our assessment will be the cardiovascular assessment. And once again, I'm kind of looking for anything that maybe there's pulsation or any type of bruit, anything abnormal, and I visually I don't see anything abnormal. The pulse of maximum impulse, point of maximum impulse should be right around right here. I feel no vibration. I feel no. There's your pulse maximum endpoint here. What I'm going to do is I'm going to go ahead and have you lay down. And we're going to find your substernal notch. And follow that across. Okay. And we're going to listen to the apical. first point. Tricuspid. And right below mid-clavicular should be our mitral, which is the point of maximum impulse and the point where S1 and S2 are heard freely. And that sounds good. Okay. I hear no signs of any kind of problems with any kind of bruit or any kind of cardiac issue. I just hear S1 and S2 freely. The next thing that we want to make sure is when we're talking about blood flow, we kind of want to look at the different pulse points. So we're going to go ahead and I'm going to compare the temporal pulse, and we're going to compare them left to right. And they are the same as far as left to right. The next thing we'll do is we'll look at the carotids. You only palpitate one at a time. And they are also equal bilaterally. We will go ahead and look at the brachial. And they are also equal bilaterally. The radial. They are also equal bilaterally. We will defer the femorals. We will feel the popliteal. They are equal bilaterally. The tibial. They are equal bilaterally. And the pedal. They are equally as well. Our next point for this examination will to be go ahead and to look at the abdomen. Okay, we're going to be looking at the abdomen. And the first thing is we're kind of looking to see if we notice any anomalies, kind of like if they were to have ascites, he may be protuberant. If there were any type of problems with maybe any kind of tumors or lumps or mass. And I don't see any of that. He also has normal pattern male hair on his chest. He has primary macules here, as well as here, and here. His umbilicus is round and is inward. He does have a on his right abdomen anterior. He also has a small, I guess it would be about 6 or 7 centimeters scar on his abdomen. He has visible a tan line around his neck, and he does have a small. It's definitely a primary macula of some sort in his chest. He does have evidence of some striae on his inner arms and some on his abdomen. His abdomen is flat, and comparing left to right, what is on the left is the same on the right. So there is no difference in that. So the next thing we will do is we will listen for vowel sounds. Bowel sounds are heard in all 4 quadrants. I will also listen for any type of organ rub from the liver and the spleen. Are you hungry? Okay, there is no evidence of any kind of friction or organ rub. The next thing that we will do is we will listen for bruits, and I will listen to the aorta. We're listening for any kind of hum or swishing sound, and I hear none. We will listen to the renals. And the iliac. And we will defer the femorals. And I hear no evidence of any kind of bruits or hum for him. The next thing we will do is I will go ahead and so I am hearing tympany with some dullness over the bladder, which is normal if he has any type of urine in his bladder. I will go ahead and I'm going to measure his liver. So what I'm going to do is I'm going to tap, and then when I hear a change in the resonance between tympany and dullness, I'm going to go ahead and mark that. And then what I'd like you to do is hold your breath. Okay, there's my change there. Okay. So normal is 3 to 5, and we are at 3.5 centimeters. So that is within normal limits. The next thing we will do is I will just go ahead and palpate. I didn't go ahead and we'll do this first because I'm hearing this is dullness over the spleen, which is normal. Okay, now I'm going to go ahead and palpate. Is there any pain?
No.
Having any kind of pain? I'm feeling no bulges, no lumps. What I want you to do is take a deep breath and hold it, and I'm going to feel your liver. Okay, let it out. Okay, I feel the border of the liver. There is no calcifications or any kind of lumps or any kind of problems with that. I will go ahead and feel for kidneys, and my hands are cold. I'm so sorry. Kidneys are, right kidneys felt retroperitoneal. No lumps or bulges. Right kidney. No. This is left kidney is fine. Okay, so left and right kidneys are both retroperitoneal without any problems there. The spleen is not normally palpable unless it's swollen or distended, and we normally don't see that unless there's a problem, in which case it is not palpable. Okay, so let me go ahead and have you just sit up and put your shirt on, and we will move into the muscular assessment. Okay, so the first thing that we're going to do with this assessment is we're going to look at the hips and the movement of the hips and the knees, and then we'll work our way down to the ankles and the feet. So the first thing I'd like you to do would be to go ahead and lift your leg up straight, okay? All right, so that's flexation and extension. Are you having any pain?
No.
Okay, so go ahead and bend your knee and lift it up, and then extend it down for me. Okay, go ahead and flex, yep, and extend, good, good. So once again, we're looking at the hips. Now let's do a little bit of resistance here. So go ahead and try to lift your legs up. Very good, okay. Now go ahead and bend this one, and then go ahead and try to extend it. Okay, and same thing with this one here. Go ahead and try to extend it, very good, okay. The next thing we're going to look at is the external and internal rotation of the hip. So what I'd like you to do is take this leg and cross it over your knee this way like this. Okay, good. This would be the external rotation, and then the internal rotation would be knee to knee. So go ahead and bend this leg here, bend it up, and push it over. That would be the internal rotation of that leg. And normally you do this bilaterally. Whatever you do on one side, you do on the other, because we're comparing to see what the differences are. The next thing I will have you do is we're going to do abduction and adduction of the leg itself. So let me go ahead and have you abduct this one, and then cross it over. There you go. Very good. Do the same thing with the other leg. Okay, good. Very good. Now go ahead and press against my hand. Okay, now press out. Very good. Okay, so he has a very good range with his legs as far as, and his hips as far as adduction or flexation and extension, and internal rotation and external rotation. The next thing we're going to move down to is the knees. We had him bend his knees before. He also extended his knees as well, and there were no problems with the knees. Next, we will go ahead and move down to his ankles and his feet. So I'm going to have you point your toes for me. If you would, go ahead and point your toes. Very good. And pull them up to your nose. There you go. Okay, so let me have you plantar flex. Go ahead and press, and then up, dorsiflex. Same with this one. Very good. Very good strength in his ankles and his feet. Now I want to go ahead and hold this up and have you rotate your foot for me. Very good. Okay, let's do the same thing on the other one. Okay, very good. I'll go ahead and pull your pant legs down a little bit so it's freezing in here. All right, I'm going to lower the bed just a little bit. All right, I'm going to have you turn around and sit on the end of the bed. Take a second. And what I want you to do is cross one leg and then uncross it and cross the other. Very good. Okay. Now what that does is we're looking at the brachialis muscles. We're also looking at the quads and the hamstrings. And that's the reason for the crossing and the uncrossing of both legs. And they look very good. Next thing I'll have you do is stand up, and we'll do a little bit of gymnastics here. Stand sideways. There you go. I want you to put your right leg behind you, and that would be hyperextending that right hip, and that's very good. Now do the same thing with the other. Okay, very good. All right. The next thing that I want you to do is go ahead and bend forward, and that's flexation. And I'm going to just check for scoliosis. Can you bend down a little bit more? Okay, very good. Okay, there is no curvature of the spine, and this is flexation, this is extension, and then lean back a little bit. That's hyperextension of the back. Okay, very good. Now what I'd like you to do is walk heel to toe, take a few steps. Okay, very good. And turn around and walk back normally. And this is just checking the gait. Okay, turn around. Next thing we'll do is balance, and this is called the Romberg test. So I'd like you to close your eyes and just stand straight. Okay, we're looking for his balance to see if he's off a little bit. No, he's very good. Okay, go ahead and open up your eyes. The next thing that we're going to look at is the cervical. But first, I'll tell you what, before we do that, let's go ahead and let's check his motor movement. Let's go ahead and do supination and pronation real fast. Okay, very good. And let's go ahead and do nose to finger. Okay, very good. Okay, very good. All right, so that looks really well. And then let's go ahead now, we're going to move to cervical. So what I'm going to have you do is I'm going to go ahead and have you flex your head forward, okay, and then you're going to stretch it out, okay, and then have you go ahead and hyperflex it. Very good, okay. Now I will have you turn to the right, and then turn to the left, and then rotate your neck. Very good. Okay, now go ahead and press against my hand. Here as well. Press. Okay, press forward, press backward, and show your shoulders. Good, good, okay. So he has full range of the muscles in his neck. Were you having any kind of pain?
Oh.
Okay, good. All right. The next thing that we'll look at, the next areas we'll look at is the shoulders. And we're looking to see if there is evenness. We're looking at the body alignment from one side to the other. And we're going to start with the shoulders and the arms. And I want you to go ahead and put your hands out in front of you, okay? Put your hands behind you, hyperflex them. Very good, okay. Now raise your arms up and raise them down. Okay, now pull them up. Pull them up against my hands, good. Push them down. Good, okay. Next thing that I want you to do is we're going to do some abduction. So out, and then adduction, and them to your body, right in front. Very good, okay. And that also checks that area as well with his arms. What I want you to do is raise your arms against my hands. Okay, good. Press them in, press them forward, and press them backwards. Okay, good. So he has a full range of motion with his arms and shoulders, and equal strength in both. Let's go ahead and work on your hands and your wrists now. So go ahead and I want you to extend your hands for me. And go ahead and turn them up. This is supination. And then down, that's pronation. And then what I want you to do is flex them down. Straighten them out. Yep, hyperflex them back. Very good. Put them forward. Now we're going to check for radial deviation. So out, and then ulnar deviation in. Very good. And now what I want you to do is I want you to abduct your fingers, so they're going to be out, and then adduct, add them together. Very good. All right, abduct your fingers out, and I want you to squeeze. Very good. Okay. Now I want you to go ahead and squeeze my fingers, and we're looking for equal strength in both hands, and he does have equal strength in both hands. Very good. Okay. Now what I want you to do is we're going to do oppositional. So I'm going to have you go ahead and take your fingers. Yeah, very good. Okay, so all the way back. Okay, very good. Okay, so the next thing that I'm going to do is, like I said before, we're looking at his body as a whole, and we're looking from one side to the other. We're looking to see if anything is off, if everything is even, comparing one side to the other. And what I need to do is I need to check for any type of pain or heat or crepitus of the joints. And so we would be checking all the joints and check the fingers as well. We're looking for any signs of arthritis, knees, no bulging, no heat, ankles, and toes. So there's no sign of bulging, heat, swelling. What's on one side is equal to the other side. So what I need you to do is go ahead and have a seat. Okay. Now the next thing we're going to do is we're going to do sharp and dull. And go ahead and close your eyes. So I'm going to touch different parts of your body, and you tell me whether it is dull or sharp. Let me first show you what it is. This is sharp, and this is dull. Okay. All right. So I'm going to go ahead and touch different parts, and you tell me whether it's sharp or dull.
Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay. The next thing that I would do is go ahead and keep your eyes closed and put one of your hands out. I'm going to go ahead and draw a number, and I want you to tell me what it is.
7.
Try it one more time.
8.
Very good. All right, keep your eyes closed and extend your other hand. And tell me what that is while your eyes are closed.
Quarter.
Okay. Okay. Next thing we'll do is 1 and 2 point discrimination. So let me show you, keep your eyes closed, let me show you what 1 point feels like. This is 1 point, and this is 2 points. Okay? So I'm going to go ahead and touch different parts, and you let me know whether it's 1 or 2 points. Okay? So
1. 1. 1. 2. 1. 1. 2. 1. 1. 2. 1.
okay. One of the last things that we do is we check reflexes, and reflexes are scored from 0 to 4 plus, being 0 being like none, to 4 plus being hyper reflexes, and normally a 2 plus is within the normal range. So what I will go ahead is we're going to test some of your reflexes. Let me go ahead and have your arm, and you're just gonna rest it here in my hand. The first one will be your triceps. Very good, and then turn it over, and then biceps. So far these two are at a 2 plus, which is the normal range. Let me go ahead and put this out. Brachial. Okay. And then we're going to go ahead and do patellar. Okay. And these are also done bilaterally. So your patellar is at a 3 plus. Your arms are at, so far we have a 2 plus and a 2 plus as well. The last one we have to do, brace your foot, and these are just normal at a 2 plus. And that concludes the final Didiotic exam. Thank you.